So in this lecture, we'll see what is ovary hysterectomy and what is the treatment of choice for the Pyometra. Both are very important MCQ as per 2019 ICAR exam. So there are some basic terminologies just like neuter, spay, and oophorectomy, then sham hysterectomy, and one is pan hysterectomy. First is the term neuter. This term neuter is refers to ovary hysterectomy. This is called as neuter. Second term is spay. Spay is commonly used with the term OHE, but the exact meaning of the term spay is the removal of ovaries. Removal of ovary. It means the term ovariectomy is best defined as spay. So, ovary hysterectomy scientifically is removal of ovary as well as uterus. But the only removal of only and only ovary is called spay. So ovariectomy or spay means removal of the ovary. Then there is one more term, oophorectomy. This terminology, it is having one letter H. This H means removal of healthy ovary. So healthy ovary removal is called oophorectomy. And simply the term removal of ovary is the terminology spay. So in one of the PSC exam 2020, they have asked the term spaying refers to. First option was ovary hysterectomy, second option was ovariectomy, and third option was oophorectomy. Like this. So this spaying is removal of only and only ovary. That is ovariectomy. If they specifically asked that the removal of healthy ovaries, then this H will help you to remember that it is the removal of healthy ovaries. Oophorectomy is having H. Then there are two terminologies, sham hysterectomy and pan hysterectomy. In both definition, both terminology, one thing is common, that is hysterectomy. And the hysterectomy is the removal of uterus. But what is the meaning of pan and what is the meaning of sham? So pan means removal of uterus from cervical end to ovarian end. So pan means complete, all the parts like uterine horn, uterine body, all the parts are removed. That is called pan hysterectomy. And sham hysterectomy means only uterine horn or only uterine body. Means if parts of uterus they are removed, either it is single horn or both the horn or only uterine body, then it is sham hysterectomy. And pan hysterectomy means pura, removal of complete all the parts like uterine horn or uterine body, everything. If this is the uterus and these two are horn and this is the body. This is the uterine ovarian and this is ovary and this is the cervix. So the removal from the cervical end to the ovarian end, which include uterine horn and which include uterine body. The complete removal is called pan hysterectomy. And the partial removal, that is removal of only this horn or this horn or uterine body. That is sham hysterectomy. Oophorectomy is the removal of this H, help you to remember H for healthy ovary. And spay means removal of only ovaries. That is ovariectomy. And the term neuter means ovary hysterectomy. That is removal of O and H. O is ovary, H is uterus. So after this basic terminology, from where one MCQ was asked that what is spaying, that is removal of your ovaries. So before starting this ovary hysterectomy, first we'll see the surgical anatomy of the ovary and the uterus. Surgical anatomy means those parts which are most anatomical part which are most important to remember during our surgical procedure. This is your abdominal aorta. This is your abdominal aorta. In the body of any animal, first we'll see location of the ovaries. Uh, Stomach, and these are kidneys. This is left, and this side we have right kidney, and here you have left ovary, and this side you have right ovary. And these ovaries, they are attached to your V-shape reproductive tract of bitch, that is uterine horn, and this is uterine body, and this is the cervix. So ovaries are, if you look at the structure of the ovaries, where they are located. So ovaries are close to, they are close to this caudal pole of kidney, and these are close to abdominal wall. Abdominal wall. Ovaries are attached with the uterus with one ligament that is known as proper ligament of ovary. Here also proper. But the more important ligament for surgical importance, this is your this ligament, suspensory ligament, which is attaching the ovaries to the dorsal abdominal wall. Suspensory ligament. So ovaries are attached with one proper ligament, and this is the important ligament, that is suspensory ligament. So this is the position of the ovaries. Then if we look at the blood supply, here is the stomach. This is the abdominal aorta. Abdominal aorta. Inside the body of animal, at least remember there are two arteries. which are direct branches of the abdominal aorta. They are renal arteries going to the kidney. The second are your ovarian arteries. Directly, they are arising from the abdominal aorta. So, ovarian artery. Arterial system, the aorta is high pressure system. So, if you are doing OHE and if you cut this pedicle this side, and by chance if you apply your ligature here and if they slip or they become loose, that may lead to bleeding from this system. So ovarian arteries, which are direct branch of aorta, that is a high pressure system, that may lead to the sudden death of the animal because of the high pressure and loss of the blood. So the common complication during surgery, after surgery, is the bleeding. Means because of this loose or slippage of your ligature, your suture material, that may lead to the bleeding. And that bleeding is catastrophic and that may lead to death of the animal. Because this artery is a direct branch of the aorta. So this is very surgical importance is very much. The important MCQ is when to start, what is the preferred age for the OSC. So the age is around 6 months. 6 months. Either before first estrus or after first estrus. The age is 6 months. Just before the first estrus or after the first estrus. If you do before first estrus, then that may decrease the mammary gland tumor risk to less than 0.5%. Means if a bitch is undergoing OHE procedure before first estrus, then in future life the chances or risk of development of mammary gland tumor will be less than 0.5. If you perform OHE after first estrus, then this mammary gland tumor risk may be more, and that will be 8%. That will be 8%. If you perform OHE after second estrus cycle, then mammary gland tumor risk may be more. That is 26%. And if you perform it after third estrus, or you can say after 2.5 years, then your OHE will have no preventive effect on mammary gland tumor development. So spay the animal before first estrus will reduce the chances of mammary gland tumor less than 1%, less than 0.5%. After your first estrus, your second or third, chances are more. After first, chances are 8%. Second estrus, 26. And after third, there will be no preventive effect. So this is related with the age. Next is how to approach for your OHE. There are two approach. One is flank and one is midline. Midline. This midline approach is nothing but the midline ciliotomy. Midline ciliotomy, that is through the linea alba. Through the linea alba. Flank, left or right? The question is, if you are going to choose flank approach, then which is better, left or right? And in case of midline approach, if you are going to choose midline approach, then where to start? If this is umbilicus and this is the starting of pubis. This part is divided into three parts: proximal third, middle third, and distal third. So if you are going for midline approach, then which approach is suitable? Proximal third or middle third? So first we'll see midline approach. Then we'll see what is the flank approach and what are its advantages or limitations. If we look at the ventral, because it is ventral midline approach, which is nothing but the approach through linea alba, which is a white color connective tissue. This is the umbilicus, and here is your pubis. This area we divide into three parts: 1, 2, and 3. This is called proximal third. This is middle third, and this is the distal third. In case of dog, you make your incision in the proximal third at this level. Make your incision. But in case of cat, because of the anatomical location of the uterus and ovary, in case of cat, middle third is preferred for the incision. So remember these two MCQ, that for midline approach, midline, that is your ciliotomy, you are entering the abdominal cavity through the midline of the animal. Then from the umbilicus to the pubis, this area is divided into three parts: 1/3, 1/3, 1/3. Proximal, middle, distal. Proximal third is chosen for the dog. So we make incision here. In case of cat, because of the anatomical location of uterus or ovary, we'll take incision here. So the proximal third from the umbilicus for dog, middle third from the umbilicus for cat. This is for the midline approach. The advantage of this approach is this structure is called linea alba. Linea alba. The word alba means white. Alba means white. Why it is white? Because it is less vascular. Less vascular. The blood supply is less. So if you take your incision here, then the chances of bleeding will be less. So this is the advantage. Second advantage, you can find uterine body with this incision easily. But because of the less vascular, less blood supply, bleeding will be less. But the disadvantage related with this less blood supply is, if you perform your OHE and after this you close your incision with the nylon, right? You close. The problem is there, if this is incised wound. This will be incised wound on the linea alba, which is taken with the help of scalpel. So this incised wound is the wound, and wound need blood supply. So there will be delay in wound healing. This wound will heal with delay. And if the animal is more active, then there may be chances that the wound may dehisce. Dehiscence is dehiscence of wound means opening of the wound may occur because it is healing very slowly because of less blood supply. So there may be chances of dehiscence. So this normally the animals are like this. And if we are going for the midline approach, this linea alba approach, this you placed your suture, you close the wound. The blood supply is less. Blood supply is less. That may delay the wound healing. Second thing is all the organs, intestine and stomach and all, because of the gravity, they will be putting their weight on this linea alba. So there are chances of evisceration. If this wound is healing slowly, there may be chances from the wound, intestine may come out. Intestine may come out. So these are the complications of this linea alba, which is having less blood supply because of delay in food. The wound may open, dehisce, and this content may come out because the animal is parallel to the earth, parallel to the ground, and all the organs they are putting their weight towards the gravity. So gravity is also is a force, and second is the weight of these organs. So intestine may come out. The second is flank approach. So this is the stomach. This is the stomach, and here is the left kidney. Here is the left kidney, and here is the left ovary. Left ovary, and this is the suspensory ligament. Similarly, this side we have right ovary, right kidney, and here is the right ovary with this suspensory ligament. So, which flank approach is preferred for the OHE and why? The first question is this left ovary. This left ovary is more mobile. More mobile. Second thing about when the animal is taking food, when food is ingested, when the food is ingested, after ingestion of food, the stomach gets distended. Food will come to the stomach, stomach gets distended. This distended stomach will push the left kidney caudally. Distended stomach push the left kidney caudally, and this left kidney will push the left ovary caudally. So because of this movement, because of this continuous movement, the suspensory ligament of the left ovary is more in length. The length of the suspensory ligament of the left ovary is more than the length of suspensory ligament of right ovary. If you take your incision, suppose this is the ventral of your animal, and for the flank approach, if you make incision like there is a skin incision, this is the incision, this is ventral midline approach, and this is the flank approach. If you make your incision on the skin here, then it is very easy to exteriorize the right ovary because it is located just beneath your incision. But left ovary is the far ovary from this incision. Left ovary is the far ovary, it is away from the incision. But the good thing is that suspensory ligament of this left ovary is long. So through this incision, we can bring this ovary out this side also. So if you make your incision on the right side, right flank, then just beneath the incision you will find right ovary. So you can exteriorize and perform your surgery. But the left ovary is the far ovary, but the advantage of this ovary is this is having long suspensory ligament. So if you pull this ovary this side, right side, because of this long suspensory ligament, it will come out at the place of your incision. And you can exteriorize left ovary also. Because of this reason, this right flank is preferred. Right flank OHE is preferred. Why left flank is not preferred? If you make incision over the left flank, then you will find the ovary just below your incision. And you will take out the ovary and you suture it, ligature, apply and close. But at this site of incision, you cannot pull the right ovary to this side because the suspensory ligament is short. So this is the reason why left flank is not preferred and why the right flank is preferred. Right flank is preferred because it is just below your incision, and from this approach you can pull left also because that ovary is having long ligament, so you can approach from right flank, it is preferred. If you do from the left side, you can easily get left, but it is having short, you cannot pull this ovary to that side, to the left side. So the best approach for the flank is the right flank. So there are three MCQ if you are doing only C-section. Second is only performing OHE. And the third MCQ is OHE plus C-section. The preferred approach should be. So as I explained, for OHE, the best approach is the right flank. These MCQ are for flank approach. So only OHE, right. If you are doing OHE along with this, you are also doing cesarean section, removal of puppy, then also right flank. But if you are doing only C-section, then left flank is preferred. Left flank. Because in this case, what you are doing, this is the uterus, you just make incision and you are removing your puppies. So in case of left flank for C-section, the advantage is on the left side you will encounter less intestine. Amount of intestines will be less on the left side. So from the left flank, you can make one incision on the uterus and remove all the puppies. So for the cesarean section, left flank is preferred. For only OHE, this is the right flank. Because in the right side, you can easily remove, exteriorize your right ovary, and from that incision, you bring the left. Because left is having more longer suspensory ligament. Similarly, OHE with C-section, right is preferred. So whether it is flank or midline approach, this is the umbilicus, the pubis, and you are doing the proximal third. And it is the ovary which is having this suspensory ligament. Parallel to suspensory ligament, what are running? They are ovarian artery, ovarian vein. They are running parallel to the suspensory ligament. This side also, this is ovary, this is the suspensory ligament, and they are tortuous, means highly coiled, long vessels are run. And this ovary is attached with the proper ligament with your uterine horn, and this is your uterine body. So, in case of ovary hysterectomy, the important step is, the first step was which approach you should use. If you are using midline or ventral approach, then move through the linea alpha. Or if you are using your right flank approach, then go through the right flank. So whatever be the approach, the second step, first was the incision, that means approach. Okay. Second is, once you reach the abdominal cavity, the second is exteriorize the ovary. What is the meaning of exteriorized ovaries? It means the ovary is having suspensory ligament attached to it. So you need to tear the suspensory ligament. So that if you tear this, so after that we can ligate these blood vessels. So the second step is exteriorize the ovary and tear the suspensory ligament. So how to, these ovaries, they are attached with the dorsal abdominal wall through this suspensory ligament. So how to exteriorize? The procedure is with your thumb and second finger, that is middle finger. So if this is the ovary, then with thumb and the middle finger, you hold the ovary, and with this index finger, you like this, just push the suspensory ligament and tear it. So hold with your thumb and second finger and push with the index finger, and in this way you can push the suspensory ligament and tear it. So with thumb and second finger you hold ovary, and with index finger tear the suspensory ligament. Is the way to perform exteriorization of ovary. After you exteriorize, your ovary. Then the third step is ligation of the pedicle. Ligation of the pedicle. This pedicle, which is having blood vessels, and this is the ovary. How to ligate? The method is known as three clamp method. Three clamp method. It means you have artery forceps. Place three artery forceps like this, and one more. This. Apply three artery forceps. Then the role of these artery forceps is, if you look at one artery forceps, these jaws, they are having serrations. They have serrations on their jaws. Because of these, on this pedicle, it will create some kind of rough surface, rough surface. So that what you do, you just remove this clamp and apply your suture. Because of these serrations on the jaw of the artery forceps, it will create some rough surface here. So you withdraw your artery forceps and apply the suture material and ligate it. The advantage of using these clamp, these artery forceps, because of these serrations, if you apply your suture material in this rough surface, it will not slip. The chances of slip will be less. So, so you apply your first here, then remove, then apply your second, and it in between from this. Then wait for 20 seconds. Check whether there is bleeding or not. If there is no bleeding, leave this pedicle into the abdominal cavity. So the role of these serrations, we are applying here suture materials. We are ligating this pedicle, which is having blood vessels, with the intention that because of these serrations, it will create one slot that the rough surface, our material will not slip. Because if it slips or become loose, then because of the massive bleeding, animal may die. So this is a very important point to take care. So once, so you applied your suture material, you tear the suspensory ligament and leave this inside the abdominal cavity. Similarly, we perform with this end also. Then what we do, this is the cervix and this is the uterine. Similar to that, here are running some blood vessels. So first we'll ligate these. We will ligate these blood vessels with the suture material. After ligating these two vessels, this pedicle, here we apply again 1, 2, and 3. 3 artery forceps. 3 artery forceps. And then we will cut from this. In between the first and second artery forceps, we will cut from here. And will remove the entire uterus with the ovary. We will cut from this one. And after this is the stump. This is the stump. So, as I explained in general surgery, wherever the stump is there, will apply one suture pattern that is known as Parker care. That is known as Parker care, where this stump we hold with the artery forceps. Artery forceps is applied. Then, with the help of suture material, we first take Lambert. We'll take Lambert. Then we remove the artery forceps. Then we'll take uh, first we'll take Cushing, not Lambert. First we'll take Cushing, then Lambert. So this is how we close the uterine, this stump, with the help of Parker care method and live inside the abdominal cavity. So in the summary, this is the ovary having suspensory ligament. This is the right ovary and this is the left, having longer suspensory ligament. Parallel to this, vessels are running. Parallel to this, vessels are running. And this is the uterine horn, the V-shaped reproductive tract of your bitch, and this is the cervix. So what we are doing at three places. Place number 1, we suture, we ligate these vessels, and after ligation keep place into the abdominal cavity. Then number 2, apply 3 clamp and then ligate and leave into the abdominal cavity. And this is the third place. Third, apply 3 clamp, cut it and apply the Parker care pattern and leave into the abdominal cavity and remove this. The complications which are related with OHE. The first complication is bleeding. If you are using a material or if you are using your ligature and that will slip or become loose, because this is a direct branch of abdominal aorta, so it may cause massive bleeding and that may lead to death of your animal. The second condition is we are removing this pedicle. There are chances that this ovary is covered with the bursa. In case of dog, we have bursa. There are chances that some part of the ovary may remain inside the body during this procedure. That is called as ORS, ovarian remnant syndrome. The remaining part of the ovary that may keep on secreting progesterone and that may lead to recurrence of the Pyometra chances if you leave small piece of tissue of ovary here. The third complication which is related with this point, here it may lead to uterine stump Pyometra or inflammation of the stump. So these are the complications. And the fourth complication which is related with the hair, number 4. Number 4 is urinary incontinence. Urinary incontinence. So urinary incontinence means the animal is having no control over urination. Normally, animal urinates when bladder becomes full. In case of urinary continence, the urine may come out on its own. just like in case of human babies, incontinence. So these are the complication of OHE. First, bleed, massive bleeding. Second, related with the ovary itself, ovarian remnant syndrome. Third is hair, uterine stump, pyometra. Fourth is below, urinary incontinence. Then after OHE, the next topic is Pyometra. As you know, Pyometra is related for P. P is the progesterone and it is mostly seen in which phase of the cycle? Diestrous phase. And this Pyometra, the main organism involved is your E. coli. That is the gram-negative bacteria. And it is mostly seen in nulliparous. That is the nulliparous animal is more predisposed. And remember the most diagnostic technique, most diagnostic technique for Pyometra is the ultrasonography. Ultrasonography. So Pyometra, that is accumulation of the pus. If we look at Pyometra, this is ovary. This case, it is open cervix Pyometra. The cervix is open. The cervix is open and pus is draining to outside. Pus is draining to outside. So first we'll see what is open cervix Pyometra. In this case, cervix is open. If cervix is open, pus is draining. Pus is draining, it means endotoxin going out of the body. Endotoxins are going out, it means therefore no chance of SIRS, systemic inflammatory response syndrome, because all toxins are going out from the cell. So with open cervix Pyometra, they ask what is the most common complication? What is the most common complication? This is the bladder, which is also opening here. Suppose this is the cervix and this part is the vestibule. And this is opening here. And this outside to the body. In case of open cervix Pyometra, from the cervix the pus is coming out. Pus is coming out. There are chances that this pus may enter into the bladder. This pus from the uterus, it might, through the vestibule, it may enter into the bladder and that may lead to cystitis. So this is a more common complication of your open cervix Pyometra. That pus is coming out, but in vestibule, because there is one more opening for the urine that is coming out from the bladder, there are chances the pus material may enter into the bladder. So this cystitis may occur. So this was something important about the open cervix Pyometra. What happens in case of closed cervix Pyometra? Closed cervix pyometra. As the name implies, cervix is closed and pyometra means your uterus is filled with the pus. To see this condition, now the uterine horn they are more distended and the body is also more distended and the cervix is closed. Nothing is draining out. It is fully distended. Here is the ovary. Here is the ovary. So this is filled with the pus. This is filled with the. So there are chances when the both holes are distended, when these both holes are distended with the pus, that pus may come out from this end. Which is this end? From the ovarian end of uterus. Pus may come out. Pus come out. That may lead to peritonitis. That may lead to peritonitis. From this side also, pus may come out into peritoneal cavity and that may lead to peritonitis. That may lead to peritonitis. The second thing about the closed cervix pyometra is the uterus is filled with the pus. The bacteria involved is E. coli, which is producing endotoxin, and these endotoxins may cause renal injury, renal insult to the kidney. That may lead to azotemia. That may lead to azotemia. And this azotemia will cause uremic gastritis. And because of this uremic gastritis, there will be continuous vomition. So continuous vomition is the most common sign of your closed cervix pyometra. Closed cervix pyometra. Continuous vomition. So because of E. coli, endotoxin are released, renal injury will be there. That may lead to non-nitrogen in the blood. That may lead to the gastritis. And because of this gastritis, continuous vomiting, which is a more common sign, the owner will complain about that there is continuous vomiting. That is an indicator of closed cervix pyometra. The another thing in closed cervix pyometra is because the uterus is filled with the pus, so these endotoxins may cause systemic inflammatory response syndrome. And because of this SIRS, there may be renal failure or there may be hepatic failure. So we call all these failure multi-organ failure. Multi-organ failure. So multi-organ failure. In such situation, in case of closed cervix pyometra, if the which is or the animal is compromised, and when the animal is compromised, second is the animal owner do not want OHE. Then what is the option with you to save the life of such closed cervix pyometra bitch, because the animal is compromised because of renal failure, hepatic failure, multi-organ failure, because of systemic inflammatory response. You cannot go for surgery. You cannot go for OHE. So what is the option to save the life of this animal and to save the breeding value of this animal? If it is a very costly animal and you have to use this animal for future breeding. So the option with you is marsupialization. This is the process. With the help of this process, you can drain the pus of the uterus out of the body and you can save the life of the animal. So marsupialization is done for the case of Pyometra. Which Pyometra? Closed cervix Pyometra. Now we'll see what is this procedure and how it is carried out. So this is the marsupialization. Your animal is compromised, which cannot tolerate anesthesia and all. Cervix is closed and it is filled with the pus. This is filled with the pus. So starting with, first take your animal in dorsal recumbency with mild sedation. No need to give general anesthesia. With mild sedation, keep the animal in dorsal recumbency. Then with local anesthesia, we call infiltration anesthesia. Just infiltrate at the ventral side. Then if this is the skin at the ventral side, below this having muscles and all, then you will get the uterus. So what we do, we give incision on this ventral abdominal wall. Then you will find, after taking incision, you will find the uterus. Okay. Number 5. Bring this uterus at this place. Bring uterus to your abdominal wall near the skin. Bring this uterus near the skin. Number 6. Use partial thickness suture. What we do, will suture the abdominal wall with the uterus. This is suture. Uterus is sutured with the skin along with muscles and all. Uterus is sutured. So partial thickness suture, it is suture. Now this area is opened. The 7th step is give incision on uterus. If you give incision here, you have sutured this and make incision on the uterus. Now what will happen? The pus will come out. Last step is draining of the pus outside. So this is how marsupialization is carried out. Place the animal in dorsal recumbency, infiltrate anesthesia local, then make incision on the skin, then bring the uterus near to the skin, then suture it with the skin, and after this make one incision on the uterus so that it will become a common passage. So this is a way to make a passage, a canal, a path, a route, so that all the pus slowly will drain out. So where the cervix is closed, so in this marsupialization process, we are removing, draining all the pus out of the body. So once the pus is drained completely, it was closed and we, this was the skin and it was draining like this. This is your pus in the uterus. So once it is drained out, close the uterus and close the skin. This is how you can save a compromised animal's life or an animal which is having high breeding value. After this removal of drainage of all pus from this marsupialization process, put the animal on fluid therapy, antibiotics, so that the main purpose is after this pus is removed, because this pus was a source of SIRS, so these SIRS reaction will decrease and you keep your antibiotic fluid therapy and the SIRS will decrease because pus drained out, and suture the uterus, suture the skin, and the animal, you can save the life of the animal. So in case of compromised animal or in case where the owner is having more precious animal, you can utilize your marsupialization process in case of low cervix pyometra. But remember in 2019 there was one MCQ, that treatment of choice for pyometra. It is not marsupialization. The treatment of choice will be OHE. This is the case where compromised animal or animal with high breeding value, we go for marsupialization. But the treatment of choice for pyometra is only and only removal of ovary and your uterus. So this was about OHE and marsupialization, open cervix pyometra as well as closed cervix pyometra.